Some important medical abbreviation. SS semi means half. AC anti-cybos before meal. IC inter-cybos between meal. PC post-cybos after meal. Nocte at night. Omni mane every morning. Omni nocte every night. Primo mane early in the morning. Mane in the morning. Omni hora every hour. MCQutr hora every 4 hours. Alternis horis every 2 hours. Oristile eardrop. Collyrium an eye wash. Collytorium a mouth wash. Hostos a draught. Emulsio an emulsion. Collunarium nasal wash. Capsule cataplasma a pollutes. Charata a powder. Creamer a cream. Injectis an injection. Insufflation an insufflation. Linctus a linctus. Liqueur a solution. Lotio a lotion. Mixtura a mixture. QS quantity sufficient. RX receipt to take. You take. HS horasomni at bedtime. Semelindae once a day. BD bisindae twice a day. TID or TD torindae or thrice a day. QD quaterindae 4 times a day. Dollar urgent to be taken when the pain is severe. Statin to be taken immediately. Tusi urgent to be taken when the cough is severe. Noristile nasal drop. Nebula a spray solution. Pillula a pill. Paste a paste. Solution a solution. Suppositorium a suppository. Tobella a tablet. Augmentum an ointment. Capendus to be taken. Pulvis powder. Frequenter to be taken frequently. Omni every. Mite sand. Mitetails sand sauce. Prodosi as a dose. Solve dissolve. Fat make let it be made. Cybos meal or food. Aqua water. Libra pound. Congius gallon. Infecundus to be rubbed in. Utendus to be used. Sumendus to be taken. Dendus to be given. Addendus to be added. Applicandus to be applied. Gutta drop. Snobs are powder. FT fat make let it be made. AD to up to. PO paros orally by mouth. Pulvis conspirus dusting powder. QID quarindie 4 times a day. QTDie daily more dicto as directed. SI opposite SOS whenever necessary. Cochlear amplum. Cochlear magnum. Cochlear maximum 1 tablespoonful. Cochlear medium 1 dessert spoonful. Cochlear minium 1 teaspoonful. Symbol of gallon. Congius C. Symbol of ounce. OZ. Symbol of pint O. Symbol of grain. GR. Sinister means left. AD leave. AD libitum as much as you please. Accusate eye preparation. Editor's vice for 3 times. Internoctem during night. AD libitum as much as you please. Be starved in die. BTID 2 or 3 times a day. Fars prore nata PRN when necessary. NABH National Accreditation Board for Hospital and Healthcare Providers. AMBU AMBU Artificial Mechanical Breathing Unit or artificial manual breathing unit bag, EKG or ECG, electrocardiogram, DVT, deep vein thrombosis, CHD, congestional heart disease, CHF, congestive heart failure, CABG, coronary artery bypass surgery, CLABSI, central line associated bloodstream infection, ADR, adverse drug reaction, MRSA, methicillin resistance staphylococcus aureus, DAS, digital subtraction angiography, STEMI, ST elevation myocardial infarction, NSTEMI, non-ST elevation myocardial infarction, PES, problem, etiology, sign and symptoms, medical diagnosis, DKA, diabetic ketoacidosis, GABA, GABA, gamma amino butyric acid, CPDA, citrate phosphate dextroadenine, VDRL, Venereal Research Laboratory Test, ASD, arterial septal defect, ALD, alcoholic liver disease, ALISA, enzyme linked immunosuppressant assay, EIA, enzyme immunoassay, ARDS, acute respiratory distress syndrome, ACLS, advanced cardiac life support, BLS, basic life support, ADL, activities of daily living, HF, heart failure, VF, ventricular fibrillation, VT, ventricular tachycardia, AF, atricular fibrillation, CVA, cerebrovascular accident, ACS, acute coronary syndrome, AMI, acute myocardial infarction, CVD, cardiovascular disease, IABP, intra-aortic balloon pump, BAP, brain type natriuretic peptide, LDH, lactate dehydrogenase, CPK, creatine phosphokinase, PSA, prostate specific antigen, ANCA, anti-neutrophil cytoplasmic antibodies, CANCAS or PR3 ANCA, cytoplasmic anti-neutrophil cytoplasmic antibody, PNACA, MPO ANCA, perinuclear anti-neutrophil cytoplasmic antibodies, KUB, kidney ureter bladder, CAD, coronary artery disease, CSSD, the Central Service Department, INR, International Normalized Ratio, HBsAg, surface antigen of the hepatitis B virus, CRP, C-reactive protein test, FSH, follicle stimulating hormone, APGAR, appearance pulse grimace activity respiration, DX, diagnosis, TAH, total abdominal hysterectomy, SOB, shortness of breath, SDH, subdural hematoma, TURP, transurethral resection of the prostate, SLE, systemic lupus erythematosus, COPD, chronic obstructive pulmonary disease, MVP, mitral valve prolapse, LLQ, left lower quadrant, LUQ, left upper quadrant, RLQ, right lower quadrant, RUQ, right upper quadrant, LT, left, RT, right, NVD, normal vaginal delivery, NV, nausea and vomiting, NG tube, nasogastric tube, LMP, last menstrual period, IO, chart, intake and output chart, NS, normal saline, RL, Ringer's lactate, BPH, begin prostatic hyperplasia, PVC, premature ventricular contraction, APTT, activated partial thromboplastin time, LBW, low birth weight, PR, per rectum, RDP random donor platelets, SDP single donor platelets, FFP fresh frozen plasma, GERD gastroesophageal reflux disease, AIDS acute immunodeficiency syndrome, CPR cardiopulmonary resuscitation, DOA dead on arrival, TPR temperature pulse respiration, PE pulmonary embolism, VTE venous thromboembolism, PET scan progesterone emission tomography scan, SOS if necessary, BAL bronchoalveolar lavage, MMR measles mumps rubella, OT operation theatre, STAT immediately with no delay now, Q1H every hourly, Q2H every 2 hours, PO by mouth or orally, CAUTI catheter associated urinary tract infection, CBD common bile duct, FHR fetal heart rate, FM fetal movement, IVF in vitro fertilization, TAH total abdominal hysterectomy, ADHD attention deficit hyperreactivity disorder, ACTH adenocorticotropic hormone, ADH antidiuretic hormone, BPM beats per minute, catheter, CMV cytomegalovirus, ECMO extracorporeal membrane oxygenation, EDD estimated date of delivery, ENT ear nose throat, GH growth hormone, GTT glucose tolerance test, H1N1 hemagglutinin type 1 and neuroaminidase type 1, HELLP hemolysis elevated liver enzyme low platelets, HDL high density lipoprotein, LDL low density lipoprotein, PFT pulmonary function test, ET tube endotracheal tube, KCl potassium chloride, CXR chest x-ray, PMO line pressure monitoring line, HME filter heat and moisture exchanger filter, HA headache, HB hemoglobin, IM intramuscular, HCT hematocrit, IV intravenous, ICU intensive care unit, CCU coronary care unit, SICU surgical intensive care unit, MICU medical intensive care unit, PICU pediatric intensive care unit, NICU neonatal intensive care unit, PACU post anesthesia care unit, CTICU cardiothoracic intensive care unit, P pulse, HR heart rate, RR respiratory rate, SpO2 oxygen saturation, MI myocardial infarction, ABG test arterial blood test, WBC white blood cell, RBC red blood cell, CDC Centers for Disease Control and Prevention, WHO World Health Organization, Na sodium, K potassium, TBI traumatic brain injury, NSAIDs non-steroidal anti-inflammatory drugs, LMWH low molecular heparin, VSD ventricular septal defect, ASD atrial septal defect, RO rollout, AAO awake alert and oriented, NKA no non-allergy, NKDA no non-drug allergies, OTC drug over-the-counter drugs, RX, UTEC, RN registered nurse, ANM auxiliary nurse midwife, GNM general nursing and midwifery, NTG nitroglycerin, O2 oxygen, LBP low back pain, CAP capsule, WNL within normal limits, TAB tablet, INJ injection, SC subcutaneous, CS culture and sensitivity, SS sign and symptoms, OP outpatient, IP inpatient, CC chief complaints, pre-OP preoperative, DC discharge or discontinue, PT patient, aka above knee amputation, CA cancer, HO history of IBD inflammatory bowel disease, ECT electroconvulsive therapy, ANA anti-nuclear antibody, ADA adenosine deaminase, PRBC packed red blood cells, DHS dynamic hip screw, RBBB right bundle branch block, LBBB left bundle branch block, MRCP magnetic resonance cholangiopancreatography, ERCP endoscopic retrograph cholangiopancreatography, CRIF close reduction fixation, ORIF open reduction internal fixation, PUSH pressure scale for healing, VIP score visual infusion flattivis score, LAMA live against medical advice, ESR erythrocyte sedimentation rate, D&C dilation curettage, NPH normal pressure hydrocephalus, MLC medical legal case, PPH postpartum hemorrhage, PIH pregnancy induced hypotension, PCV packed cell volume, ENMG electroneuromyography, FNAC fine needle aspiration cytology, CECT contrast enhanced computated tomography, HRCT high resolution computated tomography, DOTS dots directly observed treatment short course, URSL urethroskopic lithotripsy, PCNL percutaneous nephrolithectomy, GRBS general random blood sugar, ICD implantable cardioverter defibrillator, EEG electroencephalogram, MCH mean cell hemoglobin or mean corpuscular hemoglobin, MCHC mean corpuscular hemoglobin concentration, MRI magnetic resonance imaging, MRA magnetic resonance angiogram or MR angiography, MRV magnetic resonance venography, HTN or HT hypertension, DM diabetes mellitus, NOF neck of femur, DPT diphtheria pertussis tetanus, PCT procalcitonin, HCO3 bicarbonate, pH potential of hydrogen, VS vital sign, CT computated tomography, ER emergency room, ETA estimated time of arrival, UTI urinary tract infection, APH antepartum hemorrhage, THR total hip replacement, TKR total knee replacement, LRTI lower respiratory tract infection, LSCS lower segment caesarean section, PLBS post lunch blood sugar, RBS random blood sugar, LFT liver function test, FBS fasting blood sugar, CBP complete blood picture, TC total count, DC differential count, BTCT bleeding time and clotting time, PS for MP peripheral shimmer study for malarial parasites, PT prothrombin time, AFP alpha fetoprotein, HCG human chronic gonadotropin, RA rheumatoid arthritis, HSCRP high sensitivity C reactive protein, PCC puncture proof container, IgG immunoglobulin G, PPE, personal protective equipment, CRRT, continuous renal replacement therapy, DNR, do not resuscitate, HOB, head of bed, NPO, nothing by mouth, CO, complaints of post-OP, post-operative, ROM, range of motion, BM, bowel movement, UGC, University Grant Commission, LH, luteinizing hormone, dsDNA, double standard DNA, PCI, Pharmacy Council of India, MCI, Medical Council of India, AICTE, All India Council of Technical Education, DTAB, Drug Technical Advisory Board, CC, Consultative Committee, NLEM, National List of Essential Medicine, CPCSEA, Committee for the Purpose of Control and Supervision of Experiment on Animal, IACE, Institutional Animal Ethics Committee, ICMR, Indian Council of Medical Research, ICAR, Indian Council of Agricultural Research, CSIR, Council of Scientific and Industrial Research, FSSAI, Food Safety and Standard Authority, RMP, Registered Medical Practitioner, CDSCO, Central Drug Standard Control Organization, IPC, Indian Pharmaceutical Commission, BCS, Biopharmaceutical Classification System, NDA, New Drug Application, FDA, Food Drug Administration, IND, Investigational New Drug Application, NDMA, National Disaster Management Authority, US FDA, United States Food Drug Administration, NIPOR, National Institute of Pharmaceutical Education and Research, API, Active Pharmaceutical Ingredient, NVBDCP, National Vector-Borne Disease Control Program, AYUSH, AYUSH, Ayurveda Yoga Unani Siddha Homeopathy, OPD, Outpatient Department, DMARD, Disease Modifying Anti-Rheumatoid Drug. Thank you.